All right, so for the next, we'll look at physical examination in obstetrics. So for physical examination in obstetrics, we're now looking at, that's after you have taken the history from the patient. You want to now go and see things for yourself. Okay, after you have taken the history for the patient, you want to now go and see things for yourself. So for physical examination, just like I was saying, you are trying to see things for yourself. Okay, so it's a systematic assessment of pregnant women because you want to monitor how the mother's health is still being maintained. You want to monitor how the baby is also doing. Okay, so you do general examination. So you are looking at the vital signs, you are looking at her weight and height, you are looking at skin changes, okay, jaundice, signs of anemia. Then you look at the breast, okay, look at the breast. Therefore, abdominal examination is performed after 20th week gestation to assess how the baby is growing, okay, with what you are seeing on the outside, okay, how the stomach is getting big. Okay, so you inspect the stomach size and shape, you look at skin changes, look at how the baby is moving. So palpation, you are looking at the fundal height, how tall the tummy is becoming, okay, how the baby is lying, okay, as related to the long axis of the mother. Presentation, which part of the baby's head is pointing down towards the cervix. Position, you are looking at the engagement. Then you do Leopold's maneuvers. Then you try to feel for the head of the baby, try to feel for the back of the baby, try to feel for the buttocks, and try to feel for all those, aspects. Okay. Auscultation, you try to hear the baby's heart rate. The pelvic examination, where you are trying to access the mother to see the dilation, to see the effacement, see the consistency. Then you can now evaluate other systems. Lower limb to see if there's any edema, vein varicocele, thyroid gland to see if there's any enlargement. You check out for the cardiovascular system of the mother and the respiratory system to see that she's actually breathing well and heartbeat is normal.